Science from Walla Walla University. Could I have your name and date of birth, please?
Kayja 12/29/98.
Good. Nice to meet you, Kayja. And could you tell me where you are right now?
I'm in the wet nursing lab.
Good. And what day is it today?
March 1st, 2020.
Okay, perfect. And I'm going to go ahead and put your bed up. I'm going to be doing a head, ear, eyes, nose, and throat, and then full body assessment on you. Today, have you gone pee?
Yes.
Good. I see that you're already in a hospital gown, so we can get started. Go ahead and sit up for me and swing your legs over the edge of the bed. First thing I'm going to start with is I'm just inspecting your face. I see your nose is midline, and your lips also look centered. Your eyebrow hairs are growing in opposite directions. They're growing in very nice and healthy, no patchiness. The skin color of your face overall looks really good. And your eyelashes are growing in nicely. Your eyelids are smooth. There's no bumps or lesions. The scleras, the whites of your eyes, are nice and white, and you have beautiful blue corneas, and your pupils look nice and round. I'm also going to check into your lacrimal ducts really fast, and they are nice and pink, and I don't see any crusties in there. Your lips as well, they're nice and hydrated and pink, and there's no buildup on the edges of your lips, and everything looks good from just looking at you. So I'm going to go ahead and start by palpating your scalp. I'm feeling to see if there's any tenderness, so please let me know if anything hurts and if there's any bumps, lesions, masses that aren't supposed to be there. I'm also seeing that your scalp moves well on your head, and that your hair is nice and healthy and it's growing in an even direction. I'm also going to palpate your ears. I don't feel any masses or anything on there, and they're nice and malleable. I'm also going to feel your TMJ, so go ahead and squeeze your jaw together for me. Good. And open and close your mouth. Move from side to side. Good. I don't feel any popping or clicking, and it all feels good. Let's see. I'm going to check your nose patency, so if you could close one nostril for me and breathe in and out. Good. Do the other side. Good. Your nose doesn't stick together when you breathe in and out when you close one nostril, so your nose is nice and patent. I'm also going to I'm also going to palpate your sinuses, so your maxillary sinus. Let me know if there's any tenderness.
No.
Good. I don't feel anything abnormal there. And then your frontal sinus. Any pain? Good. All right. So everything looks good, feels good around your face. I'm going to do a couple of tests at cranial nerve number 7. And go ahead and pop out your cheeks for me. Good. And smile really big. And oh, you already squeezed your eyes together for that, so that's good too. And raise your eyebrows. Good. Okay, so cranial nerve number 7 is intact.
Intact.
And I'm also going to, that was cranial nerve number 5, actually. Cranial nerve number 7 is your sensations in your face. So I'm going to give you light, dull, and sharp. Pick this up. This is what, close your eyes. This is what light feels like. This is what sharp feels like. This is what dull feels like, okay? Just let me know which one you feel. I'm going to be testing it bilaterally, okay?
Sharp. Dull. Soft.
Do that one again.
Dull.
There you go.
You touch me
There was a
lightly.
little fuzz stuck to it, so that was a trick.
Soft.
Yes.
Sharp. Soft. Dull. Soft.
Good. All right. Your facial sensations are intact and healthy. Couple more things. Could you stick out your tongue for me and wiggle it from side to side? That's testing cranial nerve number 12, and that looks good and healthy and intact. All right. So now I'm going to palpate your lymph nodes. I shouldn't feel any of your lymph nodes. And if you feel any pain, please let me know. So this is your pre-auricular, your posterior auricular, your tonsillars here, submandibular, submental. Any pain so far?
Nope.
Superficial cervical, deep cervical chain, posterior cervical, occipital. Good. And then supraclavicular. And while I'm here, I'm going to test your skin turgor, and it's very elastic and brisk, bouncing back, which means you're very well hydrated. So everything feels and looks good. So far, I'm going to go ahead and push my hands up and palpate for your carotid pulses. Okay, I feel them evenly bilaterally, and they're equal in rate, rhythm, and amplitude. I'm going to go ahead and listen for bruits in your carotid pulses. Go ahead and hold your breath for me. To activate the bell of the diaphragm, I have to press it a little harder. Good. Breathe. Hold your breath. All right, I didn't hear any bruits on the right or the left side. Go ahead and turn your head that way for me. And to the left now. I don't see any jugular venous distension. And now push against my hand, push against this hand, shrug your shoulders up. Good. Good muscle strength in your shoulders, and by pushing against my hand and pushing against my shoulders, I'm also testing cranial nerve number 11, which it seems to be good and intact. All right, I'm going to now inspect your eyes. I already looked at the outside, so I'm going to go ahead and do a couple of tests to test your vision. The first one is for the optic nerve, and I'm going to have you cover one eye. I'm going to cover the same eye and let me know if you can see this.
Yep. Yep. Yep.
Okay, cover the other eye.
Yep. 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 Yep.
Okay. Your it's okay. Your peripheral vision is very good. And I believe I said it was cranial nerve number 2. And then cranial nerves number 4 and 6 are your 6 cardinal gazes of extraocular eye movement. Go ahead and look at the tip of this pen, and you're going to follow, keep your head still and follow the pen wherever it goes. Good. Good. Your cranial nerves number 4 and 6 are working very well. The next thing I'm going to test is your, your corneal light reflex. Good. And I'm just looking to see that the light bounces back in your eyes in the same spot, which means that your eyes are round. I'm going to be testing one thing with that is cranial nerve number 5, and you can look that direction for me. Good. Look that direction for me. Good. And that is definitely intact. And the next thing I'm going to do is cranial nerve number 3. First one is testing your direct and consensual pupillary accommodation to light. And there we go. And I'm going to shine a light in this eye and look to see if your pupils accommodate evenly. They do. They both constricted and opened even. Just on this side. Do that one more time. Good. They were both even on each side. Look at this tip, and I'm going to test your accommodation. This is also cranial nerve number 3. So look at it. I'm going to bring it into the bridge of your nose. Follow it and back out. Good. They accommodated evenly. The next thing I'm going to do is check your red light reflex. So just look straight back that way. And I'm going to come in here and look at your red flashback. I got that. And look back that way. Good. Red light reflex. And now I'm going to take a deeper look in your eyes. Good. Okay. And then I'm going to take a look in the left eye.
Stop. Okay.
On both the left and the right side of your eyes, I saw some veins and arteries, as well as the color of your retina, which was a nice yellow color. I wasn't able to see the optic disc or the macular area, however. And I believe that's everything for your eyes, so I'm going to move on to your ears. I already palpated the external structure, so I'm just going to go ahead and take a look inside your ears. And I'm looking to see that your tympanic membrane is intact and pearly gray. Up and back. Okay, I see your tympanic membrane. It's very nice and pearly gray, not too much cerumen. This side, pull up and back. You know if this hurts you at all. Good pearly gray tympanic membrane, and not too much cerumen on that side either. And there were no perforations. And I'm also going to perform a couple hearing tests on you, which are all three of them are testing cranial nerve number 8. So the first one I'm going to do is I'm going to have you close one ear. I'm going to go behind you. I'm going to whisper a word and you tell me what you hear.
Banana.
Okay, close your other ear.
That was so loud. Huh? Shark legs?
Not quite.
There's chocolate.
It's chocolate. Yes.
I had one ear closed.
Shark legs. Shark legs.
Shark
have
legs.
Don't have legs. Could you imagine instead of sharks
In
swimming,
Moana,
it's just
yeah.
them walking on the ocean floor with their
This
legs?
is a video.
Sorry, I'm sorry. Okay,
It's okay.
cut or continue.
All right. So I'm gonna do another test. It's called the Weber test, and just let me know if you can hear this evenly in both ears. Good. All right. And the last test I'm gonna do, also cranial nerve number 8, is the Rhine test, and this is going to let me know if you've got any hearing loss. So I'm going to place it behind your ear, let me know when you can't hear, and then I'm going to put it in front and let me know when you can't hear that, okay?
Okay.
Okay, so then you're gonna bend at the knee, and then we're gonna have you.
Okay.
Okay, that was a good 2-to-1 ratio, twice as long on the front, which is your air conduction, which is what we want. I'm going to do it the same thing on the side.
So put your knee up and underneath your ankle, and then feel your soft heel. Okay, and push. Put your ankle down at your butt. Okay.
Okay.
Extension. Straight. Okay. And then go ahead and resist. Okay. Resistance. Okay. Perfect. Now your next leg, 90 degrees. Go to the focus here. Okay. And resist. And resist. Okay. Now down. Okay. Now we're going to
Okay.
your
Good.
hips.
That was also 2-to-1 ratio, twice as long in the air conduction as the bone conduction. So it looks like your ears are good and healthy. The next thing I'm going to do is I'm going to move on to your nose. I already tested for nose patency, so I'm going to take a look up in your nose to make sure everything looks good and healthy. It's okay. All right, look up for me. Oh, I also see that your septum is midline. Okay, look up for me. Let me know if this hurts. Oh, I'm so sorry. Okay. Okay, I'm gonna look at the other side now. All right. So what I saw on both sides is that your septum is intact. There was good, nice pink red color in there. I didn't see any edema, no abnormal discharge, and yeah, it all looked good. I'm going to test cranial nerve number 1, which is your olfactory nerve, and I'm going to have you close your eyes. I'm going to give you a couple things to smell. Close one of your nostrils. And let me know what this is.
Wow.
Yes. And I'm going to do one more. Let me know what this is.
So just to your chest.
Mint?
Yes, that's correct. So cranial
Gum?
Yes, it's actually 5 gum.
Oh.
Cranial nerve number 1 is
have some? I'm
good
just
and
kidding.
intact. And we move on to your mouth. So I already inspected the outside structures. I'm going to go ahead and take a look at the inside. My light is just having a heyday today. Okay. And your teeth look nice and even. Open up for me. Your gums look healthy. Your mucous membranes are nice and moist and intact. It looks like you have all your teeth in there. And I can see your tonsils. They look nice and pink. No redness. Abnormal redness, at least. So I'm going to take a little deeper look in your mouth. And I'm going to test cranial nerves number 9 and 10. So open your mouth for me. Look in there and go ah.
Ah.
Good. When you went ah, I saw the uvula wiggle and your soft palate lowered. And then the last thing we're going to do is a final test for cranial nerves number 9 and 10. And go ahead and open your mouth for me.
Now check myself because
Okay, good. You have a gag reflex. All right. Everything looks good and healthy in your mouth. The last thing I'm going to end with is cranial nerve number 7. And this is going to be a taste test, just to test the anterior and posterior portions of your tongue. Excuse me. Go ahead and close your eyes for me. Stick out your tongue. Start with the anterior portion.
Something.
Yes, ma'am. Nasty.
I know.
Okay. What do you taste?
Sweet?
Yes, that's correct.
Yeah, that was gross.
Lick your hands. Okay. More flavor.
Sour.
Yep, that's correct. Okay, I'm going to test the posterior portion of your tongue. Close your eyes.
Salty.
Okay.
Doing it in the same order?
I don't know.
Yeah, sweet.
What do you want?
Sour.
Okay. And just because I don't want to leave you on that.
Ew.
Some sweet so you don't have such a bad taste in your mouth.
Thank you.
Sucks a drug.
Okay. Keep going.
Okay.
Sorry.
Okay. So I have.
Keep going.
Completed
I'm
your
just gonna laugh.
head and ears and eyes and nose and throat inspection. Just going through in my head to make sure I didn't miss anything I can think of at the moment. Okay, I'm going to move on to your pulmonary assessment. So would you mind dropping the top part of your gown down so I can see your chest? Alright, so I'm just starting by inspecting your chest. I don't see any, you don't seem to be labored or breathing. Everything looks good. The color of your skin looks nice and healthy. I'm going to go ahead and palpate for any crepitus or masses and let me know if you feel any tenderness.
Nope.
Nothing? Go ahead and do your back as well. You don't feel anything there?
Nope. No tenderness.
Good, and I don't feel any crepitus. I'm going to go ahead and test for tactile firmness. Go ahead and say 99.
99. 99. 99.
Good. I felt even vibrations on both sides. And I'm also going to check for your chest excursion. So I'm going to do this and go ahead and breathe in for me. Good. And my fingers spread apart evenly, which means your chest is rising even on both sides. I'm going to go ahead and percuss to hear your body sounds, okay? I should hear a good hollow sound. You lift up your bra for me. Okay, everything sounds good. I'm going to go ahead and listen to your breath sounds in the same patterns. Go ahead and breathe for me. Okay, mind lifting your bra? everything your lung sounds were nice and clear. I didn't hear any adventitious breath sounds. Okay, so now I'm gonna have you flip around on the bed and I'm going to do the same thing on your back. Okay. All right. So I'm inspecting, your color looks good, your shoulder blades are even, and I'm going to go ahead and palpate a little farther down. I palpated up here earlier for any crepitus or masses, no tenderness you're feeling? Nope. Okay, good. I'm going to go ahead and test tactile firmness, 99.
99. 99. 99. 99.
Okay, good. And I felt even vibrations all around there. One thing I'm going to do is test your transverse diameter versus your posterior diameter. So I'm going to take this diameter here and make sure that it's half of your back, and it is. So you have even transverse posterior diameter. And let's see. So I'm going to start. I'm going to do chest excursion. So go ahead and breathe in for me. Good. Breathe out. Okay.
Sorry.
It's okay. And the chest excursion was normal, like it was on the front. My hands spread apart evenly. And go ahead and percuss your lungs region. Okay, everything sounds good there. I'm going to go ahead and listen for any crackles or adventitious breath sounds again, and breathe as I place the stethoscope.
I ate like 2 hours ago. Didn't you just DoorDash something here once? Or like get delivery?
Okay, everything sounded good and clear. No adventitious breath sounds, no crackling. The last thing I'm going to do is I am going to measure your diaphragmatic excursion. So what I want to do is have you lean forward a little bit and take a deep breath in and hold it for me.
No break. Okay.
Okay. And I got it. All right, and the mark is right there. And are you breathing?
Oh no! Oh my gosh!
I didn't realize it. Sorry.
You in the pool.
Go ahead and breathe for me. Take a few deep breaths, reoxygenate
If I
yourself.
did that, I didn't think of it. I wasn't winded. I'm good. Okay,
You don't want you passing out on me. Breathe out and hold it. Okay, breathe. Please. Thank you. Oh boy, my pen just and it has. Here it is. And right there. Okay, I'm gonna do the same thing on the other side. Go ahead and breathe in for me and hold it. Okay. Mark right there and breathe.
Oh my gosh. I don't know why I keep forgetting.
No, it's okay. I keep forgetting to tell you. All right, so go ahead and breathe in and hold, and then out and hold the exhalation. Okay. Breathe. Good. Okay, I'm gonna go ahead and measure these marks I've made, and 6 centimeters on the left, and 5 centimeters on the right. And the right side is a little higher than the left, which is normal because that's where your liver is. All right, I've finished everything on your back side, so you can turn around again and go ahead and lay down for me, actually. And you can put your gown back on.
How? Side is? Oh. Go.
Perfect. And do you want your legs covered or are you
Nah.
hot? Okay.
Yeah, it's hot in here.
And it's very hot in here. All right, so I'm gonna do your cardio assessment. So just expose your abdomen, so covered. Okay. So I'm just looking at your chest. I don't see any visible PMI, which is point of maximum impulse, and I don't see any abnormal contours either. And all right, I'm gonna go ahead and palpate for any lifts, heaves, or thrills.
Let me pull it down.
Okay, I'm gonna go under here. Good. I don't feel any lifts, heaves, or thrills, which is good. We don't want to feel any. All right, I'm going to go ahead and listen first with the with the diaphragm of my stethoscope, and we're just going to place it lightly on your skin, and that's the diaphragm for this cardio stethoscope, okay? And this is the second right intercostal space, it's aortic. Listen to my heart sound. And your second left intercostal space is your pulmonary. Yes, please. Your third intercostal space on the left side is your Ebbs point. Then I'll go up from left to bottom. Don't mind. And your fourth intercostal space, that is your tricuspid. And fifth intercostal space, midclavicular line, mitral. All right. I heard a good S1, S2 sounds. Now I'm going to go back through and listen with the bell of my stethoscope, and this is a cardio stethoscope, so I'm going to be pressing it a little harder to activate the bell, and then listening for any groovies. Okay, same pattern. Second pulmonic or second intercostal space on the right side, aortic. Second intercostal space on the left side, pulmonic. Third intercostal space on the left side is Ebbs point. And fourth intercostal space on the left side. And fifth intercostal space midclavicular line is mitral. Oh, and the fourth one was tricuspid. I don't know what I said. All right. We did not hear any bruise, which is what we want, so your heart sounds nice and healthy. All right. So that's everything for your cardio exam. I'm going to move down to your abdomen, so you go ahead and put your gown back on your arms. Okay? And I'm actually going to cover your legs here for this one. And then you can pull up your gown so I can see your abdomen. Okay? And
Pink undies.
I'm going to put a pillow under your knees. This is going to help just relax those abdominal muscles so that nice and malleable. All right, so starting by inspecting your abdomen, the color looks good. I don't see any scars or any abnormal protrusions. The hair is growing in a good direction, and you have
I know,
a little fuzzy. And your abdomen is flat. I'm gonna go to the edge of the bed. And I'm going to have you lift your head up, okay? And I didn't see any abnormal protrusions there. Okay, you can relax. And I see that your belly button is midline with your nose. All right, so to begin the abdominal assessment, I'm going to auscultate your vowel sounds first. And I'm listening for any vowel sounds in 4 quadrants, starting with your right lower quadrant. This quadrant is kind of hypoactive. Your right upper quadrant is active. Your left upper quadrant, hypoactive. Your left lower quadrant is active. Okay? So everything sounds good in your bowel sounds. I'm going to go ahead and listen for bruits over your abdominal arteries, starting with your aortic artery, and I'm going to activate my bell of my stethoscope by pressing down a little harder than I normally would. Okay? This is the aortic artery. No bruise there. The right renal. No bruise. Left renal. No bruise. Right iliac. No bruise. Left iliac. No bruise there. Your right femoral. No bruise. Left femoral. No bruise there. So everything sounds good, and since I didn't hear any bruise in your abdominal aorta, I'm going to go ahead and palpate for it. Good, and I feel it. It feels nice and healthy. Okay, I'm going to go ahead and percuss in the 4 quadrants of your abdomen, and I'm listening for a nice tympanic sound. This is the right lower, the right upper, left upper, left lower. Everything sounds good. I'm also going to feel for the edge of your liver. So I'm going to put my hand under your back, and I want you to take a nice deep breath in and hold it for me. Good. Here's the edge of your liver. Go ahead and breathe. It felt firm and smooth, and there was no lumps or bumps on your liver, which means it's good and healthy. I'm also going to percuss your liver span. So I'm going to start down here and listen for when I hear the bottom. Okay. I know what pain is in here somewhere. It's nice to have mark the lowest point. I'll lift this up a little bit. I'm going to keep percussing. Okay. And this is the top of it. And get my ruler, measure this in centimeters. So this is about 7 centimeters, which is in the normal range. You have a nice size liver. The next thing I'm going to do for your abdomen is I'm going to palpate first superficially. Let me know if there's any tenderness, and I'm just feeling for any unusual masses. Right lower quadrant, everything feels good. Your abdomen is nice and soft. No pain? Nope. That was the right upper quadrant. Moving to the left upper quadrant. Left lower quadrant. Everything feels good. I'm going to do a little deeper palpation. Still no pain? Nope. Right lower quadrant. To the right upper quadrant. Left upper quadrant. And left lower quadrant. Okay, your abdomen feels nice and soft. I didn't feel any abnormal masses or anything. The last thing I'm going to do is I'm going to feel for your femoral pulse. Okay, I feel it on the right side, just nice and palpable. Feel it on the left side as well. That is nice and palpable. And the final thing for this, I'm going to percuss your costovertebral angle. So I'm going to have you sit up for me. And I'm going to just hit my hand on your back, and you tell me if there's any pain. No pain? Do you feel any pain? Nope? Okay. Go ahead and lay back down. You can cover yourself up. And I'm going to uncover your feet now. And I'm going to start the musculoskeletal inspection.
I haven't shaved.
It's winter time. No lady shaves. All right.
It's spring.
This area is going to be
Okay, yeah, it's spring. I guess it is spring. The end of winter.
I know, it's almost spring.
Okay, so as I see your feet, it looks like good coloring. I'm going to check your capillary refills. They are all under 3 seconds. Your nails look nice and healthy. I felt the temperature of your feet is actually very warm, which is good. Means you have good circulation. I'm going to feel for your pedal pulses. This one is your dorsalis pedis. There we go. Good, that's palpable. Same on this side, both palpable. And then I'm going to feel for your posterior tibial. They're both even and palpable on both sides. And then I want to do a test on the bottom of your foot, and it's called a Babinski test. Ooh. Okay. Okay. And what I was looking for there is that your toes don't spread apart. You're very ticklish. Your toes don't spread apart, so that's a negative Babinski test. I'm going to check for edema in your lower extremities. There's none on that side. No edema on this side either. Go ahead and flex your feet for me. Hyperextend your feet, them out. Move your ankles in a circle. Good. And push against my hand. Push against my hand. Pull back. Pull back. All right. You have very strong muscles in your foot. So I'm going to come this way.
Oh, yes.
Because I'm going to have her lift her legs up, and she does not have her clothing on.
Shorts on.
Okay.
The
So,
camera.
do you have your gown?
Oh yeah.
Yes. I'll try to cover you up as much as possible.
Thanks.
All right. So I'm going to take this pillow out from underneath your knees. Okay. Go ahead and relax your legs down again. So I'm going to have you bring one of your legs all the way up, straight. Straight.
Oh.
Straight. There you go. Straight up and back down. Do the
I'm
other
not
leg
very
too.
flexible.
Good. And bring that leg back up and move it out that way. And bring it back towards me. Up. Bring it back towards me. There you go. And bring this leg up. Bring it out in that way. Up this way. Good strong abductor muscles. Push down. Push up. Good. And push down. Bring this leg up. Push up. Push down. Okay. Now bring your hip up and have your knee at a 90-degree angle. I'm going to feel for your popliteal pulse.
Gaze directions. So then you just follow.
Okay, I feel that one. That's good. And so we do your knee test. Bring your knee all the way up to your chest. Like this. Okay, and bring it back down. Okay, and do the same thing with the other side. Okay, bring it back down. Good. And bring it up at a 90-degree angle. And push down. So the knee. No. And same with the other side. And the angle, push up. Push down. Okay, good.
And I'm just
Have
gonna put
good
a glove on.
strong muscle strength in your legs. And I felt for all your pulses. Everything feels good down there. I'm going to go ahead and cover your legs back up. Is that how this goes? Yes. Okay, and then you can go ahead and sit up and swing your legs over the edge of the bed. Alright. So, since I touch your feet, I'm going to wash my hands and start your upper extremities testing. I'm going to see your hands for a second. You have good coloration in your fingers. I don't see any swelling in any of your interphalangeal joints or your metacarpal joints. Do you feel any tenderness in here?
No.
No. And I'm going to check your capillary refills. All under 3 seconds. It's good. That's where we want it to be. Temperature of your fingers are good, like I said, and the color is nice and pink. I'm going to have you do a couple of cerebellar function tests. So I want you to touch each finger to your thumb as fast as you can. Good. And supinate and pronate your hands as fast as you can. Good. And bring your heel to your shin and rub it up and down. And the other side. Good. And some more. Oh, close your eyes. Put your arms out like an eagle. And take your pointer finger and touch your nose with one hand. And put it back. And then do it with the other hand. Perfect. All right, you can open your eyes now. You can open your eyes now. I'm going to do a couple more things with your hands. The first thing is I'm going to feel your radial pulses. They're nice and palpable, a strong beat. And then your brachial pulse. Nice, strong, and even beats on both sides. And then I'm going to have you close your eyes one more time. And I'm going to put something in your hand and tell me what this one is.
Combo.
Oh yeah. And then how about this?
Coin.
Yes, do you know what kind?
Dime. No, nickel.
Nope.
No penny.
Yes, it's a penny. All right. Keep your eyes closed. I'm going to do some 2-point discrimination, and just tell me when you feel it change to 1. Okay? Two.
Okay. That was good. Now we're going to move over. Is that everything?
Ooh.
One.
Yes. Okay. It was actually like that close for one. That's really good. Okay, so I'm going to do on this side. Close your eyes.
I'm just going to feel them.
Ignore that one.
One. Two.
I don't feel any masses
Two.
or any bumps.
Two.
One. Good. So you have very good 2-point discrimination. I'm also going to test your peripheral sensations on your arms. Go ahead and close your eyes. This is similar to what I did for your face. So tell me if you feel sharp, dull, or soft.
Dull. Sharp. Soft. Dull. Soft. Sharp.
Okay. Your sensation is all intact. A few more things that I'm going to have you do with your hands is grip my hands as tight as you can. Good. Even grip strength on both sides. Flex your wrists, or flex your wrists this way. Hyperextend your wrists. Push against me. Pull back, and then put them down.
Would you like to see?
Pull, push. Okay. Good muscle strength there. And then a few more things. Your elbows, flex
Okay,
them
I'm just going to throw this over here.
and extend them. Good.
Okay, so
And then flex them one more time.
for your ears.
And pull and push. Good. And then bring your arms out like this and
I'm going to
push down and
cover one hand.
do some circles with your shoulders so I can see your shoulder range of motion. Good. Everything looks good. Bring your hands up here and back down. Good. And hug yourself. Good. And try to put your hands up back here. Good. All right. Okay. And let's see.
Oh, okay.
Anything?
Sorry, I have to think though.
Yes, so I'm going to do your reflexes. So I'm going to do this reflex hammer. I'm going to start with your, flip your arm over. I'm going to start with your brachioradialis reflex. Show me your tendon here. There it is. Okay.
So that means that the vibrations in my ears are working together at the same time, you know? Now we're gonna
Do you feel anything in your hands?
testing
Say-
for bone. Well, this is gonna go in your
Oh
bone.
yeah,
I saw it. There you go. Okay. Go ahead and flex your elbow for me. Flex your bicep. And I feel your tendon right here. Okay, relax.
And I'm gonna be timing with my little
I did not hit my thumb. Okay. And go ahead and have your arm up like this. And relax it into my hand. This is your triceps reflex. That last one was your biceps reflex. Good. I'm gonna do those same things on this side. Start with this one. Relax.
Awesome, that was a 2-to-1 ratio. About
Good.
30, which is
That's crazy. And flex your bicep.
to the other side.
Okay. And relax.
A little bit more that way.
Just relax your hands too. Well, I can't get that one to go. That's okay. And then your brachioradialis reflex. I saw all 3 of these fingers twitched. Okay. And okay. Couple things I forgot to do is test your neck range of motion. So go ahead and look this way. Touch your chin to your shoulder. Look the opposite way to your left. Touch your chin to your shoulder. Good. Hyperextend your neck.
Now we're going
Good.
to over to your
Look down. Good.
and I'm gonna put gloves on once
And
again.
hyperextending your neck reminded me that I did not look at your trachea. So I'm going to do that really fast. So your trachea is midline and it's palpable and movable. And your thyroid gland is here. Go ahead and swallow for me. Good. And so your thyroid gland moved easily. Okay, I'm going to go back to reflexes and then your patellar reflex. Okay. And I'm just going to hit your patellar tendon and see if your foot kicks. Ooh, yes, very healthy. And on the right side. Whoa, that one was crazy. Okay, and the last thing I'm going to do is your Achilles reflex. So just go ahead and relax your leg. Okay, yes, her foot pushed down into my hand. And relax on this side too. Okay, your foot pushed down into my hand. Alright. All of those reflexes looked good and healthy. So go ahead and stand up for me. And we'll close it off your gown. Have you walk. How do you close it? Just hold it closed. Oh. Okay, I'm just going to look at how you're standing. That's good. You have good posture. You're not bent over. Can you pull you down tight? Okay, your hips are even and aligned. Go ahead and walk towards me. Okay, close you down and turn around and walk back. Okay. Your gait looks good and normal. Okay, you can face back this way. Go ahead and close your eyes, put your feet together. This is the Robert test. Test under number 8. And you can open your eyes again. You're not swaying or anything. Go ahead and do heel to toe walking. That's good. And do it backwards. That's good. And that looks like it's all intact. And lastly, stand on one foot and hop. And stand on the other foot and hop. Alright. And last thing I'm going to do is I'm going to have you hold your gown closed and turn around. And I'm going to help you close it, and I'm going to have you bend over and touch your toes. I promise I will make sure you touch your toes. I'm just looking along your spine to make sure that it is straight and midline. Okay, you can stand back up. It is. That was checked for scoliosis. And that's the end. Go ahead and that's everything I have to do on the floor. So go ahead and get back in the bed. And you can push your legs in. Oh. And that's the end of my head to toe assessment. And if you need anything, the call light's right here. I'm going to lower your bed. Do you have any questions before I leave? Alright. We'll check back up on you in a few hours. Okay? Bye.